So now the lights are up for a while. We're going to look at the eye movements, the extraocular muscle function. Okay, and what I'd like you to do, I'm going to see how your eyes are moving. So if you can just stare at my finger, I want you to hold your head still. Okay, and follow my finger with your eyes. Don't move your head. Okay, so we can look this way and up and down. Follow me over to this corner and up and down. And we can even check in the midline directly up and down. Okay. The next thing, now those were cranial nerves 3, 4, and 6. We've tested cranial nerve 2 already. Now we're going to move on to the 5th nerve, so we're going to check for facial sensation. We're going to screen for it. And a good way of doing that, as well as the sensory exam later, is perhaps to use a cotton stick applicator, okay? And tease the head of the applicator to get a little wisp of cotton. And we could actually snap the stick to get a pokey, sharper end for testing for pin later on. But for the facial sensation, I'm just going to use the cotton. And what I'm going to do, I'm going to test your sensation over your face with this little cotton swab. I'm going to ask you to close your eyes, okay? And just tell me when you feel it, okay, and where you feel it. Where's that?
On my forehead to the right.
Okay. How about there?
And to the left.
Are those pretty equal?
Yes.
Sensation? Okay. How about here?
My cheek on the right, cheek on the left, my chin on the left, and the right.
Okay. So what I've done is checked the 3 divisions of the trigeminal nerve sensory branches, V1, V2, and V3, over the forehead, cheek, and along the chin or jawline. Okay. Next, we're going to look at the cranial nerve 7, the facial nerve, and I'm going to see how your muscles are working in your face. So if you could raise your eyebrows up for me. And how about give me a big smile, show me all your teeth. Great. Okay. Next, we'd like to do the 8th cranial nerve and just screen for hearing. And this is rather crude, but I'm just going to see how you could hear the rubbing of my fingers. If you can close your eyes for me. Okay.
Left, right.
Okay. Or we could use a ticking watch or a whispered word in much the same way. Next step, we want to look at cranial nerves 9 and 10. And one way of screening for that, and you may need to grab the ophthalmoscope or otoscope or your pen light to look inside the mouth. Could you open your mouth for us? And tilt back a little bit and give me a ah.
Ah.
And here, what I've seen is that her palatal arch and uvula rise symmetrically in the midline. Now, that really doesn't technically test cranial nerve 9. That's probably testing cranial nerve 10, the motor function of elevating the palate in the uvula. Now, if we really wanted to test cranial nerve 9, that would involve the gag reflex, which is sometimes distressing the patients. So we're skipping that for this screening exam at this point in time. The other thing I like to do is, if you could turn that way, can you just cough for me? Okay, so her cough sounds normal. And the other thing is I want to test some muscles around your shoulders here. So I've got my hands on your shoulders. Could you just raise your shoulders up for me? And they move well and strongly on both sides. And the other thing I'd like you to do is turn your head toward me and hold it there. Don't let me push you. And you can see her left sternocleidomastoid tense. And turn your head to the left there. Don't let me push you back. And her right sternocleidomastoid tense. Okay. Now we're going to look at your tongue. If you could open your mouth, stick your tongue out for me, and wiggle back and forth. And it moves well either way. There's no atrophy or any abnormalities there. So we've now gone through vision, and we've gone through the cranial nerves. At this point, we're going to get into the motor examination. We're going to start looking at the upper limbs while Nancy's seated on the table. And as we're looking at the limbs, while I'm moving them and testing for strength, I'm also observing, and I'm looking to see if there's any atrophy or abnormal movements, fasciculations on one side or the other while we're doing all of this. So as I start, what I want to do is check the upper limb tone. I just want to feel your arm here. Just let everything go loose, play dead, let me do all the work. So while supporting the elbow, I pretty much just gently want to move her arm passively at all the joints. So what I'm doing, I'm moving at the shoulder joint, I'm flexing, extending at the elbow joint, I'm even pronating and supinating the forearm, and I'm moving the wrist in extension, flexion, abduction, and adduction. And that passive movement there gives me a feel of her tone. I feel a little bit of resistance. It's not abnormally increased. And then I'll look at the other limbs, same thing. Just going to let this guy go floppy. And I'm going to be kind of moving at the wrist, elbow, and shoulder joints all in one smooth move. And that tone feels like a normal amount of resistance, and they both feel about the same. So that's great. And I don't see any asymmetries or any problems there. Now the other thing we're going to do then is checking strength or power in the upper limbs. There's a few muscles we'll check on the screening exam, although there are many more that we could test. So let's pick a few muscles to test pretty much at each joint. Okay? And they would be graded on a system that could be recorded in your note as to if there's a weakness, okay, with 0 being totally motionless and paralyzed up to 5, which is full strength. So first thing what we could do is, could you do this for me? Could you extend up here like this? Okay, and this is shoulder abduction. We're checking at the shoulder, and I'm going to push down, just resist me. And she's got excellent strength. I cannot overcome that at all. Can you put your arms down? Then we're going to check at the elbow joint here. So what I'd like you to do is make a muscle. Don't let me push you down. Okay. And how about over here? Don't let me push you down. Excellent. And now keep it right here. Now push me away with this arm. Okay. And same thing here. Very good. Now we're going to look at the wrist joint. And if you could make a fist for me, keep it right there. Don't let me push your wrist down. Better yet, cock it up a little. That's wrist extension. And now bend it down. Wrist flexion. Okay, thank you. And let's try over here. Pull it up. Cock it up. Wrist extension is strong, and wrist flexion is strong. Let's look at the fingers. And what I'd like you to do is get even with me and just squeeze me. Okay. And I have to ask her to let go. She's got a very strong grip there. Okay. So now we've looked at some screening for the upper limb muscles with regards to tone and strength. And at this point, let's have you lay back on the exam table. I'm going to pull this out for your feet. Okay. And we're going to look at the lower limbs with regards to their tone right now. And I'm just going to plop your leg around just like we were checking your arm. So try and let everything go loose. And I'm supporting behind her knee and moving at the hip joint, knee joint. And I'm going to grab the foot and move it around as well. This is a good opportunity to check for ankle clonus in this position. So what I'm going to do is just dorsiflex the foot like this. If there were ankle clonus, then I'd see sustained jerking like this, plantar flexion movements. I just made that up. These aren't present. And then we'll look at the other limb, the left lower limb. Again, support behind the knee, moving around at the hip and knee joint, grabbing the foot and moving it back and forth. And again, checking for clonus by pushing up and passively dorsiflexing, and there is no clonus there. Okay. Now with the lower limbs, typically I'm going to check one limb at a time with regards to muscle strength, as opposed to what we did with the upper limbs.